The Patient and Family Echo project is already changing the way health professionals work by enabling the launch of quick, flexible campaigns in almost any professional setting.
The overall project is rolling out a patient feedback tool across organisations in the NHS and beyond. Locally, the project is a short 2-week campaign that engages frontline staff to feedback on behalf of their patients on a web-based tool.
What makes the social media-like tool so successful is its simplicity. Anyone can use it virtually without training.
Patient and Family Echo is a useful process because it enables people to share their ideas when they've got time to do so, not having to turn up to meetings when they're requested to do so. It means that you can set a 2-week window and your staff can share ideas on how to solve complex problems about improving the patient experience.
For many years we've employed lots of different feedback tools, all the traditional methods of surveys, questionnaires, etc. And that can be quite difficult to ensure that they're effective and that people engage in them and that it's something that they're used to. This particular tool is good because although it is about patient experience, it's asking the staff what they think the patients want. So some of it's about direct feedback they might have had from the patients. Some of it's also, I think, about innovation as well. So it's trying to generate new ideas too, based on their experience of working with the patients.
The software enables managers to respond very quickly. It is built around particular campaigns. These are expressed as specific challenges, and relevant staff are invited into these online challenges and encouraged to present ideas for positive change.
What's particularly good about it is that it is a 24-hour access. I think another advantage of it is the anonymity that they have, that they don't have to feel inhibited in what they're going to say.
Another benefit is the speed with which challenges can be presented and completed.
It has a very quick turnaround from the 2 weeks that you actually have the campaign to drawing off the main themes, meeting with the staff, putting action plans together. So for me, a real benefit is something that it's very quick. It doesn't drag on.
The first test of the project was with health visitors like Andrea Johns. It came at a time of uncertainty in the department.
Morale had been a bit low, people had been quite quiet really and thought they weren't being heard. And I think we went to this meeting that was set up sort of by our management, and we had somebody there from our Strategic Health Authority as well, and we had the people from Clever Together that were introducing us to the scheme. I think the enthusiasm in that room and the fact that health visiting at that point was also being picked up. We knew politically we were centre stage and we were going to be getting more staff and we had to be implementing this programme. I think the whole atmosphere just lifted to think that we could actually do what we knew we needed to do, and we could get the ideas in there and there would be an action plan that our management would then follow. It just made people feel a lot happier and a lot more keen to go ahead and do it.
The first challenge proved a great success with dozens of ideas posted in the fortnight campaign.
The first challenge was about the future. If health visiting could be as perfect as it could be, what would it look like in the future of the service? There were 7 ideas that were taken up from, they were the top ideas, they were taken from the Echo to be put onto an action plan. And that was done via the Echo website as well, so we were able to pick up those ideas and start to work on them. Very good ideas, and some, as I say, that were simpler than others to actually act upon. But it was good to have the long-term goals as well, because that can then influence our service delivery plans and how we move forward into the future.
It shows the staff that we want them to contribute their views and ideas, and it shows that we want to engage them in our service planning and our delivery and our patient experience improvement, really.
I wasn't surprised that they jumped into it because I knew the ideas were there, and I think we just needed a platform to put them out there to everybody else, and we needed to speak to the commissioners, and we had been looking at how to do that for a long time, and I think this way just meant everybody's ideas were straight on that platform. You couldn't, with a meeting, you just couldn't get the same input from as many people.
One of the crucial capabilities of the software is the way it allows participants to rate other people's ideas. By doing so, it also enables managers to codify key themes which can inform future change.
So that's good from my point of view, because when it's finished, I can see straight away what were the most popular, most highly rated contributions. So then when I go through afterwards, I can pull them off. The beauty of this campaign is it doesn't actually need many people to be involved to get it up and running. I led the project and I'd used it before, so it was quite simple for me to pick it up again and build on past experience. What's important is that you have the right service manager involved, so you can work with them and they can take some ownership and run with the actions afterwards. You also obviously need the staff involved that are going to be taking part. They need to understand what they're going to be doing and when and so on. So it's important to engage them quite early on. Apart from that, then you just need to work very closely with your specialist collaborator who are providing the software and the platform, make sure everything technically is up and running and you're ready to go.
The project is already generating partnerships and is spreading very successfully across a number of different organisations.
There's 11 ambulance trusts in total, and they've already spread it to 4 of them in a short space of time, and they've got another 2 or 3 that are very keen to get it going. I think their ambition is to spread it across the whole of the ambulance trust.
So I guess the key issue is, what do we do to start moving these things on?
The Health Visitor Challenge has also enabled the project to liaise very successfully with a new and potentially important partner, the local authority.
The focus of the campaign was, how do we look at closer integration in terms of the early health agenda between health visitors and the local authorities' preventative family support services. And I think we've got some very useful information through the campaign, and we will be using that then to frame some real world engagement between, not that there isn't real world engagement between the teams, but to frame some workshops between the 2 sets of staff so we can turn those ideas into an action plan.
It was really exciting and a good opportunity to do that in view of all the changes that we're expecting over the next couple of years in the commissioning, the local authority and public health and so on. We are going to be working very closely together anyway.
We talk about involving our staff, don't we, all the time, but often the mechanisms for doing that are mediated through lots of meetings, lots of feeding up through hierarchies. With this campaign methodology, you get the voice directly from the staff, and also you can pick up the strength of feeling around. There is also the danger, isn't it, that the most vociferous rise to the top, and you don't necessarily get that full cross-section of staff views.
So to start off with, you, Linda, Jonathan, you told me you had a challenge around improving the way your 2 organisations work together. Do you want to tell me a little bit more about the challenge?
This NHS Patient Feedback Challenge project is already transforming practice. Its early success and the ease with which it has been achieved means that the methodology will be more widely and routinely deployed.
I think it will be embedded as part of our practice. Within the NHS, I think we work across a lot of different organisations, no matter where you are in the NHS, you're multi-agency. I think it's a real chance to be able to discuss ideas amongst those different agencies that work for the same patients, and then to get your answers from there and then build your plans. So I think any health agency could use it.
Well, our intention is to share it out into the wider multi-agency partnership, so taking it to the Children's Trust and using it really as an example of how we can move forward, from frontline engagement to getting to a strategic plan.
We're just going into phase 3 of the project now. Our plan was to roll it out to 18 of the trusts. We've done 8, so we've got another 10 that we plan to roll it out to before the actual project is finished. After that, what we're hoping is that we've set up enough expertise within individual organisations that they can actually run another campaign themselves. So you've got the knowledge and you've got the skills and the understanding of the tool itself to actually run more campaigns in the future within their own organisation. So we're hoping that the project will have some longevity.